So now starting with the very first unit or the very first chapter of removable partial dentures, that is introduction and various classifications of removable partial denture. So firstly, before starting with anything, what we need to understand is how do we define a removable partial denture, or what is removable prosthodontics. Okay, before this we studied complete dentures, that also comes under removable prosthodontics. So the replacement of missing teeth and the supporting tissues, whatever the teeth which are missing and the supporting tissues, if you are replacing, that is removable prosthodontics. Right, now removable prosthodontics has two divisions. First is removable complete prosthodontics and second is removable partial prosthodontics. Okay, so in the removable partial prosthodontics, again you have two, that is extracoronal, that is outside the crown surface of the teeth, and intracoronal, okay, that is within the crown surface of the teeth. Now there are various terminologies which we should be aware about before starting to learn about your removable partial dentures. So the very first terminology which comes to mind is the abutment. So how do you define an abutment? What is abutment? Abutment is a tooth or any portion of a tooth or that portion of a dental implant also, right? So it can be a whole tooth, it can be some portion of the tooth, or if you are placing an implant additionally, again that portion of a dental implant which is going to serve as a part of support, or it will retain the prosthesis. That means it will keep the prosthesis in its place and also provide that adequate amount of support. Then next we have is retainer. So retainer is again a fixation device. Okay, it is any form of attachment which you apply onto the abutment teeth. Okay, right, suppose if this marker is an abutment teeth, I apply a cap, this is a teeth, I put a crown on this teeth, so I am additionally applying a retainer on this abutment teeth. Okay, so where you can put your clasp assembly of the RPD, right? Then we have extracoronal removable partial denture. So what is extracoronal removable partial denture? Mainly it is outside the crown structure of the teeth like a normal RPD. Okay, so that is mainly dependent upon the parallelism of the two surfaces of the abutment teeth. Suppose in this diagram over here, if you see, there are two proximal surfaces of the teeth. So the parallelism of the two surfaces of the teeth is more important in your extracoronal removable partial dentures, right? So that it can pass freely and come out also freely. If they are not parallel, somewhat like this, inserting the RPD and removal of the prosthesis becomes difficult, right? So that is why parallelism is very much important. Along with that, you need to also have your retentive units. Okay, retentive units like your clasp assembly, right? The most common retentive unit is your clasp or a direct retainer. So ultimately you are not invading the abutment teeth, you are just putting anything onto it, it is not going inside the structure of the abutment teeth. Then next is a tooth supported removable partial denture. Now there are two divisions over here. Okay, we'll understand them. First is, if I write over here removable partial denture, right? So when I'm writing removable partial denture, I am talking about something which is removable and which is replacing partial dentition, that is removable partial denture. Now when I talk about removable partial denture, I have teeth and I have tissue. I have both the things when I'm talking about removable partial denture. When the removable partial denture is only staying on the teeth, that is a tooth supported RPD or an removable partial denture. When it is on tissue plus teeth, so tooth plus tissue, that is called as tooth and tissue supported RPD. So this types of RPD receive support from the teeth as well as tissues. Okay, now if I want to explain these two conditions, see these two diagrams. diagram A and diagram B. In diagram A, you can see no teeth present in this posterior segment on both the sides, right? Whereas in diagram B, you can see two terminal teeth, two last molars present, and then you have an edentulous space in the center. So when I make a RPD on arch like A, what happens is my RPD will take more support from this tissue area, maximum support, because it is going to seat on this tissue. Along with that, it will take some support from the teeth where I am putting my clasp, occlusal rest, and all the parts, right? So now this becomes tissue plus teeth, whereas these kind of RPDs like image B, what you are seeing here, you have last teeth where you can put your occlusal rest and clasp, and ahead also you have teeth where you can put your clasp and rest. So majority of the support or almost all of the support will be from the teeth and very minimal from the tissue. So that is why it is called as tooth supported RPD. Usually when we talk about the tissue supported or tooth and tissue supported, they are seen in distal extension cases. Distal extension means the edentulous area is extended distally on one side or on both the sides, right? Whereas when we talk about the tooth supported, there is edentulous area but it is bounded by teeth on both the sides. Okay, so that is a difference. So that is what we are talking about, your tooth supported and tooth and tissue supported RPD. Then I also mentioned about distal extension. So the denture base that extends anteriorly or posteriorly and is supported by teeth at one end. Okay, so anteriorly you have teeth and tissue at other end. They are called as distal extension partial dentures. Okay, similarly we have temporary removable partial dentures. So they are used in patients where tissue changes are more, where you can see that if you fabricate a permanent prosthesis, after some times the tissue might change and you might have to go for fabrication of a new, because the old size of the RPD won't actually fit, right? So that is why in that cases we give a temporary removable partial denture. For time being it is worn, and then as there is change we can in future fabricate a final prosthesis. Okay, then we have interim dentures. Okay, so interim dentures are, these are your temporary partial dentures used for short period to fulfill the aesthetics. Okay, interim. So intermediate dentures. Suppose patient got the teeth extracted and has to visit somewhere in the nearby town for a wedding. So you give an interim or an intermediate denture which will just fulfill majorly the aesthetics and in a minor way the comfort and the mastication, right? So those are your interim dentures. Then we have something called as transitional dentures. So now the name itself is explaining that transitional dentures, right? So that may be used when we feel that after 3 months the additional teeth which are present might get extracted or might fall off. So in that case we might need to add up teeth in our RPD. So that is a transition, right? You are changing the number of teeth in your removable partial dentures. So that are called as transitional dentures. So these were some of the common terminologies which were important. Now moving on to the important aspect, that is the indications of your removable partial dentures, right? So now if we talk about indications, the first and the foremost indication would be length of the edentulous span. So when I talk about the length of edentulous span, so the length of the edentulous span can be short or long. So now when I can say that there is one premolar over here, one molar over here, both the sides same situation. So I have only 1 and 2 teeth missing on both the sides. This is somewhat like a short span edentulous arch. When we talk about long span edentulous arch, it will be like in the whole arch from one side this much of the teeth will be absent. So majority of the teeth absent will make it as a long span edentulous arch. So length of edentulous arch, why it is important? See, when you are talking about fixed partial dentures, a fixed partial denture is what? You take support from 2 teeth, you trim them and you place 1 teeth in between, or it increases. But that follows a law, and that law is very much important, and that law is your Anti's law. Okay, so when we talk about Anti's law, what does Anti's law state? That the total pericemental area, okay, according to the Anti's laws, the combined or the total pericemental surface area, okay, of the missing teeth should be equal to the number of the abutment, or should be lesser than the number of abutment teeth. So suppose if I am drawing, I already have the diagram. So suppose in this image over here, if you see the second one where I'm put a green tick, the highlighted ones are the missing teeth, okay, and the bright ones are the natural teeth. So the total pericemental area of your abutment teeth, that is number 1, 2 and 5, should be more than your number 3 and 4, because you are replacing 2 teeth with the support of 3 teeth, that is still acceptable. But if you are in a case where you need to replace 4 or 5 teeth taking support of 2 teeth, then you are not following the Anti's law, and when you are obliterating or breaching the laws, what happens is the scenario changes and the things worsen up, right? So in that cases where we have long span edentulous arches, where we cannot give fixed partial dentures, we go for another treatment option like removable partial dentures, correct? So that is why length of the edentulous span is very much important. Second comes the age. Now for very young age patients, okay, below 16 or 17 years of age, we cannot actually recommend them giving permanent crowns, okay, because the pulp or the teeth are still developing. The pulp horns or the amount of pulp chamber will be very large. You cannot adequately reduce the amount of tooth for placing a cap. So in that cases, for time being, you give an RPD, and then in future you can go with a fixed treatment option, that can be a fixed partial denture or an implant, and that usually depends on the clinical condition, right? One more thing about the age factor is that when we talk about the older patients, the teeth are usually worn out, right? And when the teeth are worn out, what happens is there is not adequate amount of height of the teeth present so that you can give a crown, right? So in that cases also you might have to go with a option like removable partial dentures. Then third thing is the abutment teeth. Now abutment teeth, again, it's very important. See, you can only give fixed partial dentures if you have a terminal abutment teeth. What do you mean by terminal abutment teeth is, suppose I have this whole arch, and in this whole arch, if I have one teeth over here, still I can think of giving an FPD, taking these 2 teeth, or additionally taking support from the anterior teeth. But in a case where I don't have any teeth in the posterior, I cannot give fifth partial dentures. They are totally contraindicated, because you need support from both the sides. You cannot do a cantilevering. Cantilevering is what? You just take support on one side. There is more weight coming on this side of the prosthesis, which usually bends or breaks ultimately, right? So that is why cantilevering is avoided in cases of fixed partial dentures, okay? So that was about the abutment teeth. Then there is something called as periodontal support of the remaining teeth. Sometimes you will feel that the periodontal support of the teeth is not good. There is more amount of bone loss present, vertical or horizontal bone loss which is present, right? And you feel that the teeth are not yet sound enough or ready to withstand the force of a fixed partial dentures, right? So in that cases also you might have to select an option of a removable partial denture. So if the periodontal support is not good, you will have to think twice before going with a fixed option. Then there is something called as cross arch stabilization, right? So when we are giving an RPD, there are 2 types of forces. One is the left and right force, one is the front and back force, right? So when you are giving a prosthesis which is adapting on both the sides of the arch, it is going to be stable, right? When you are giving a cast partial denture, when the patient bites on one side, it doesn't lift on the other side, right? Why? Because it is cross arch stabilized. It will not get lifted. We are incorporating parts and different components in our denture so that we get that stability, okay? So cross arch stabilization is very much important. It can be in mediolateral or buccolingual or antero-posterior also, right? Then excessive bone loss. Yes, again, if there is trauma to the teeth, trauma from occlusion or more amount of bone loss, as I said, the vertical or the horizontal bone loss, right? So in that cases, it's better to leave that teeth or spare that teeth from your prosthesis and given normal RPD instead of a fixed partial denture, right? So that the teeth is at least left as it is not subjected to more amount of forces, right? So in that cases also you have to go with removable partial denture. Immediate teeth replacement, yes, if the patient has lost a teeth and immediately wants a replacement, till he cannot wait till the wound is healed. After extraction we have an extraction socket, right? So we usually advise the patient to wait till the time it is healed and then go with any kind of prosthesis. But usually the patients don't wait. If it is an anterior teeth, they are more conscious about their appearance. So in that case what happens is you need to go with an immediate treatment option like an RPD. Again, aesthetics as a concern, which I explained, right? You can easily and quickly satisfy the patient. If the patient is having any emotional problems or physical problems or cannot afford a fixed partial denture treatment, so in that case also patient desires sometimes that he doesn't want to trim his healthy teeth and go with a fixed partial denture option. Instead he would like to go with an RPD. So the patient might show a desire also, right? Now, what are the clinical scenarios where we can think or where we can prefer giving a removable partial denture? The different clinical scenarios where we can prefer giving a removable partial denture. So the first scenario is where there are more than two posterior teeth present, like on one side or on both the side, right? So now to replace over here one teeth, we have good amount of support from molar, premolar on this side also, right? So when you have more than two posterior teeth or four anterior teeth missing, suppose in the second case scenario, four anterior teeth are missing, over here one anterior teeth is missing, right? So otherwise you have anterior plus posterior missing edentulous, present edentulous areas, right? Two distal extension with one anterior, but you have canine and two premolars, right? So if the canine and the two adjacent teeth, that might be one lateral or one premolar, two premolars, any combination, right? So in that cases, when there is no distal abutment teeth, as I said, if you don't have any terminal abutment teeth, you can go with an RPD like this is. In how symmetrical it looks when it is fabricated following the principles. If there are multiple edentulous spaces, right? If the distal or the molar or the teeth, posterior abutment teeth is tilted, then in the cases of FPD, what we usually prefer is we need to chop the teeth in such a way that they are tapered and parallel to each other. Now when you go to trim this kind of tilted teeth, you have to trim more from the mesial side, which might lead to pulp horn exposure sometimes, right? So to avoid that, if it is severely tilted, you can go with a normal single teeth RPD also, right? Then if the teeth is periodontically weakened, right, the anatomical crown and the clinical crown ratio are, the difference is very much. So in that cases you can go with a RPD instead of FPD. You don't have sufficient number of abutment teeth, severe loss of tissue, okay, in the edentulous space, or very old patients who cannot go under a, or very old patients who are not ready for that meticulous fixed partial denture treatment and wants to go for an RPD. Okay. Now there are also scenarios where we avoid giving a removable partial denture, right, where the patient is having a very large tongue, where he will deliberately protrude the tongue and make the denture dislodge or come out, right? If the patient's attitude, if the patient is mentally retarded, you cannot give a removable prosthesis. It might break in the mouth, the patient might swallow, because the patient's brain is not developed properly, and someone needs to be there 24/7 with those kind of patients. So in that case, it's better to go with a fixed option so that the patient cannot remove also and nothing happens, right? Or in the cases where there is poor oral hygiene, right? If the oral hygiene is not maintained, you can see that the patient is not concerned about his or her hygiene, then in that cases also we can avoid removable partial denture and go with a fixed partial denture. So this was about the indications, contraindications of, and general considerations, some few terminologies which we should be aware about.